This conference will now be recorded.
Okay, Casey and Chrissy, are we ready?
Yeah, we're green light.
Okay, thank you. Today is Monday, June 15th, 2020. It is about 3:02 p.m. and I am calling the Lincoln County Board of Commissioners meeting to order. Do I have Commissioner Hall?
Present.
Okay, and Commissioner Hunt?
I'm here.
Okay, we do have a quorum with all three commissioners present, or remotely present, I should say. I'm now just going to do a quick kind of attendance and sound check. So Christy and Casey.
Yep, we're here.
Yep, we're here.
Wayne Belmont.
Present.
Rebecca Austin.
I'm here.
Okay, Sheriff Landers.
I'm here.
Wiley Thompson.
Wiley's here.
Nicole Fields.
I'm here.
Okay, Roy Kenyon.
I'm here.
Okay, Janet.
Yes, I'm here.
Okay, Dr. Seidlinger.
I'm here, thank you.
Great, we hear you, thanks. Jerry.
I'm here.
Okay, and Rachel.
I'm here.
Oh, no, can't hear you, Rachel.
How about then? Can you hear me now?
There you go. Yep. Okay, thanks everybody. That's why we do this in the beginning. So, all right, I'll now ask you if you're not talking to go ahead and mute your phone. First item we're doing is the adoption of our consent calendar. These are items of routine nature. If either staff or commissioners has a question or wants to pull those off the consent calendar, we can do that. Otherwise, I will entertain a motion.
This is Commissioner Hall. I move for adoption of the consent calendar as presented.
Okay, go ahead, Doug. I will go ahead and second Commissioner Hall's motion. We hear you. All in favor say aye.
Aye.
Okay.
I hear you. Are you an aye, Doug?
Aye.
Okay. You are a little baby, like kind of tunnelish,
yes.
but I can get a few words from you. Okay.
Well,
all right. Go ahead, Commissioner Hunt.
I just obviously am having audio problems, and I apologize. I don't know what else to do.
You sound good that last time, so hopefully that'll hold.
Commissioner Hunt, if you take your video off, it might help with your bandwidth as well, if that's something that he can do in a public meeting.
Okay, let's see that. Can you hear me now?
Much better.
All right, well, I'm here virtually, if not
Okay,
visibly.
yeah, you sound much better. Okay, thank you. Next up under discussion and information, and I did kind of take the agenda apart and rip it apart and put it back together today, just to kind of hopefully make our conversations today flow a little bit better. So first, we're just going to kind of get down into several discussion information items. I want to thank Dr. Seidlinger from Oregon Health Authority for joining us today. Thank you so much for being here with us to help give us an update, both to us and everyone watching on what's going on, but also in helping guide us through some policy discussions we're going to be having as well. So thank you. So first I'll turn it over to Nicole Fields or Rebecca Austin, whoever would like to go to give us an update, and then we will have an update from Dr. Seidlinger as well. It's okay if you kind of lump the general update in with the outbreak update together. That is all right.
So thank you, Commissioner. This is Rebecca Austin. I'm the Director of the Public Health Department and the Incident Commander for our response. And I'm going to start out and then I'm going to pass it to Nicole for more specifics. So I just want to give the board an update on all that has been going on since Friday last week. A big part of the team worked over the weekend. We got a lot of resources coming to us from the state Public Health Department and from DHS. So I just want to quickly go over those so you know what is happening and you're aware of all the things that are going on. So we did get a supply of thermometers the other day, and we got some Atma test kits that are from the state public health lab. So we have about 350, I believe, that are sitting in the emergency EOC right now. So those are ready to be deployed when we feel we need them. We also got three people from the state actually came on site. Haley Leslie, who is our emergency preparedness coordinator for our region, and she's very familiar with our team. She's been here before exercising with us, so it's great to have her on board. Michelle Patton from DHS came to help us really dig in and set up our essential needs response. And then the director of the Public Health Division, Lillian Shirley, also came to just give us her support and sort of push on state resources for us. So that was really nice to have them on site most of the weekend, actually. So, and then some of the resources that we asked for are a lot to do with being able to efficiently and effectively reach out to our Spanish and Guatemalan speaking populations. So that is something we're still struggling with because so many of the people affected by the outbreak at the Pack Seafood are Spanish or mom speakers. So we have put a lot of resources out there to help us doing outreach, coordination, to help us with the language, just the interpreting and translation for print, audio, and video. And then we also asked the state to help us out with some redundancy in our PIO and JIC because we only have 2 people plus Casey, and they are getting very tattered around the edges. So we need to have somebody come in and help relieve them so they can take a much needed break. And then we're also asking them to help us with some equipment so that we can get the message out better to this population as well. So then just a quickie, because I think Nicole is going to fill in around the edges here, but for our Mass Care and Essential Services branch, we have hired Asia Richardson. Thank you, Commissioner Jacobson, for finding her for us. She is a gem. She's one of those people that just digs in because she wants to help our community. So that has been awesome. And she will be working with Alma Baxter from DHS Self-Sufficiency, and then there's a small team coming together that are also just used to helping this population. Hello? Oh, I thought I heard somebody speaking. Okay, so anyhow, so then I think I will at this point, unless you have any questions for me related to the resources and the help that we're getting from the state, I'm going to turn it over to Nicole to update you on some specifics about testing, case investigations, and contact tracing.
Hey, Rebecca, one thing I guess I would say is I was told this morning that you guys are still waiting for a PIO help. And so I did have communication with Director Allen from OHA, and he said he would get right on that. So I guess please let me know if you know, by then today or by tomorrow morning that we still don't have a name. Or if there's other needs, obviously, that come up.
Thank you.
Great. So good afternoon. This is Nicole Fields. I'm Deputy Director for Public Health. I want to first give you a numbers update. So in Lincoln County, we currently have 206 confirmed cases and 5,636 confirmed cases in the state of Oregon. I think one of the things that we want to do now that we are getting so many new positives is really focus on testing. We feel like if we can get some mass testing done, we feel like we can kind of help control the spread a little bit better. So we have 3 mass testing events that I kind of want to talk to you about to give you some information on. The first of which is a mass testing drive-through event. And that is for people that were case contacts of any of the outbreaks we currently have going on. And then a lot of workers that might have just come into contact with someone that was a positive. Our goal was to test 300 people at that event. We are partnering with our public health partners from Clatsop County to work on that testing. And I just talked to Shelly, who was the last woman in the appointment setting center this morning, and she said we had 333 appointments set up for that testing event. So that's really exciting that we're going to be getting a lot of people tested in the next few days at that event. We are also working this week to test some of our long-term care facility staff. We're hoping to have that done in the next 2 days. We realize that's a vulnerable population, so we want to really make sure that we're getting testing done there as well. And then we have Project Trace coming to Newport probably within the next week or so to do random sampling of about 400 volunteers, and that is targeting the most affected neighborhoods. So that is a project that we are partnering with OSU on, and they are going to help us with the random sampling of those 400 volunteers. We are going to be obviously, with that amount of mass testing, we are going to be expecting some additional positives. Our contact tracing and our case investigation teams are up and running at, full capacity. We have 11 contact tracers right now that speak Spanish, which has been our biggest need, and we keep getting more. So we are adding additional people as we go, but we have 11 right now that are doing those case investigations and contact tracing. As a reminder, the case investigations and contact tracers can work with the public health department, calling all of the people who have tested positive for coronavirus. And then the tracers ask them to recall the names of everyone that they have recently spent time with in person. And then we call all of those people to let them know they may have been exposed and that they need to quarantine and stay home for 14 days. Isolation and quarantine does mean staying in your home for 14 days, so we have some resources available. I would encourage anyone who is on quarantine that needs support services to call our call center. That number is 541-265-0621, and they can help connect you to resources such as if you need a safe place to quarantine, if you need food support, if you need a thermometer. These are all services that the call center can kind of hook you into. The hotel service, I know I actually got to be a part of that process for the first time this weekend in linking someone to care. It was pretty seamless and easy to get them housing that they needed so they could quarantine safely. So all of those services are up and running as of today. And I would say go ahead and call the call center if you need additional help and you have been placed on quarantine by public health. So I'm going to stop there. Rebecca, do you have anything you wanted to add to that, or do you want to go ahead and move to the state?
Yeah, I'll say that there are also some resources that the essential service people will be working with Alma on to provide rent assistance and lost income. So there are some options for our families, and I do believe at the mass testing event tomorrow, there will be flyers that will be going to all these families, giving them that information in the language that they speak so they know to call the call center and really get this thing going. So, because people are pretty desperate right now, so we need to get it up and running.
Okay, with that, let's maybe have an update from Dr. Seidlinger as well from kind of the OHA perspective. And I think besides just the Lincoln County situation, it'd be nice to kind of get the perspective of kind of what's happening in Oregon as well.
Hey, thank you, Chair Jacobson and other commissioners, members of the Lincoln County staff, and members of the public. Thank you for having me here. I know that this past week and a half has been a very challenging time for the community. with a tremendous number of individuals who tested positive in the community. This has had great impact beyond just those individuals who tested on the broader community and on the businesses in the community, above and beyond the impact that those businesses have already suffered from our community mitigation measures, the Stay Home, Save Lives orders. So, thank you for all your partnership and in this response. I will say you heard the recent update on the Lincoln County numbers. A little bit behind here, this has been a tremendous collaboration between Pacific Seafoods, who's been a great partner in this, Lincoln County and OHA, with many of your neighboring counties and tribes and other institutions stepping up to offer support. I know some of that support hasn't arrived as quickly as we would have liked, and I know that we are actively working on your PIO request as we speak. At least we were just before this call, and I'm sure that hasn't stopped. One of the challenges that comes in working on this investigation is the vast majority of people were reporting without symptoms, or what we would call asymptomatic. What we know of, not just in Lincoln County, but that folks without symptoms or folks before they develop symptoms, who we call pre-symptomatic, are able to spread the disease. The exact magnitude of how much impact that has on the spread of the disease, we don't know, but we're learning more and more every day as we study this virus. When people don't have symptoms, it's hard to determine when they got sick. And so you'll see when you look on the website, almost all of the Lincoln County cases from this outbreak are reported to have onset on one day, and that's because we assign their date of onset to 2 days before testing. Part of that is challenging in the investigation as we try and figure out who was sick when and where some of the initial transmission might have come. So we continue to work through the investigations to get that answer. More than 80% of the folks have been contacted and had their investigations complete, which is a great testament to the Lincoln County Public Health and the partners and other assistants that have come in. We know that in addition to the Pacific Seafood Association, there have been associations with several other restaurants, I think at least 4 by my count, and another business in the county. The response to mass testing has been great, and I think getting more individuals tested will help us get a better picture of the spread of this disease in Lincoln County. In addition, as the state moves forward with testing of all residents and staff in long-term care facilities, in the discussions we had this weekend, we're prioritizing getting that testing available to the facilities in Lincoln County, as we do know that there could be some crossover between employees and community members that are impacted by this outbreak, as well as staff in some of those facilities. So we hope to, again, partner with Lincoln County Public Health and hopefully get a team out that can start doing some of that testing this week, so we can get a baseline of how that could be impacting some of our most vulnerable Lincoln County residents. When we look at the situation at the state, what we're seeing is similar to what's happening in Lincoln County, though obviously the population in Lincoln County is much smaller in comparison to the magnitude of the outbreak you're seeing. We have over 5,000 cases in Oregon, and we still have one of the lowest case rates across all states. And I think that's a testament to the early action that we took with executive orders and the sacrifices that everybody made to stay home and save lives. Now, as we come out of our baseline and go into reopening, what we have seen is since May 15th, when reopening started, that we've seen an increase in transmission. That was to be expected as more people had contact with others, that we were going to see an increase in cases. That increase is driven by a few different things. Initially, when we reopened, we were seeing significantly increased testing week to week, which continues, but our test positivity rate, meaning the percentage of those tests that were positive each week, was actually declining. That means that we were likely picking up folks, we were doing adequate testing and not identifying significant new disease, but rather testing folks who we know there were more cases and we were picking up, and we were likely picking up more of those cases, but not identifying new cases. That has changed in the last couple of weeks with our test positivity rate going up, likely meaning there are new cases and new transmission in the state, and we are picking those up. Those cases are being driven by a couple of things, some large workplace outbreaks like you're experiencing in Lincoln County. A lot of those center on agricultural workers, both folks, seasonal and migrant farm workers in the fields, as well as our food processing workers in seafood and other food processing plants. In addition, what we've seen since the reopening, and particularly with an uptick around Memorial Day, is more spread in social gatherings. These are family and friend-based gatherings that are happening throughout the state, not in huge numbers above the mass gathering limits that are set out in phase 1 and now those counties in phase 2, but in these smaller groups that would be allowed. Many people ask about the impact of protests and demonstrations, particularly in the larger cities like Salem and Portland. We have been working with local public health to ask about participation in these events. We know that there can be some reluctance to report on that participation. We've identified a handful of cases in Multnomah County that have reported attendance at one of these events, but we don't yet know if that's where they obtained their disease. It doesn't seem to be right now a significant source of spread of this disease. These new cases that we're picking up right now, particularly with the workplace outbreaks, tend to be people with mild symptoms or no symptoms at all, and we haven't seen a huge uptick in hospitalization. We've started to see those hospitalization numbers go up over the last week and a half, and that's indicative of disease transmission that happened a few weeks ago. I know that we've had a total of 7 hospitalizations in Lincoln County associated with folks in these newly identified cases. What we do have is sufficient hospital capacity, both in the coastal region as well as in the rest of the state, to handle the cases we're seeing now, but we're keeping an eye on that to make sure that that doesn't increase any more sharply. So with that, that situation in mind, and the increased cases in Lincoln County, the increases cases across the state, and some specific metrics for the counties that had applied to move forward in reopening last week, the governor initiated a pause, essentially, with keeping every county where they were, which meant that Multnomah County's application to go from baseline to phase 1 was put on hold for at least a week, and 3 counties, Marion, Polk, and Hood River, who are applying to move to phase 2, were also put on hold. Each of those counties individually had some public health metrics that they weren't meeting. So we continue to monitor the data, and what we look at is things like the increase of new cases, how many new cases are hospitalized, is our public health system able to track those new cases in a timely manner, meaning reaching out to cases within 24 hours, most of the time, 95% of the time, and are we able to track those cases back to a source in 70% or greater time. The metrics statewide that are trending up and that are kind of playing into some of the policy discussions now on the broader state level are an increase in cases over the past couple of weeks, a slight increase in hospitalizations, and an uptrend in the number of cases that aren't traced back to a source. We continue to watch those and have discussions with the governor's office about what that means for the pause this week and what that could mean for those 4 counties who are applying to move forward. Right now, there's not a significant enough or concerning enough metrics across the state to consider moving counties back, but really a need, I think, to increase our messaging and communication about the importance of social or physical distancing, that when people are gathering, they're gathering in small groups, not traveling far from home, and when they can't maintain that physical distancing, that they're using face coverings as appropriate. Face coverings and that physical distancing are 2 very effective ways we have to control the spread of this disease as we move forward with reopening parts of our economy. What we're seeing in Oregon certainly mimics some of what they're seeing across the country. Every state is different and is experiencing different timings in their reopenings as well as in their cases. But most states who are reopening are starting to see some increase in cases with a subsequent increase in hospitalizations. Similar to the statistics in Oregon, the percentage of cases that are being hospitalized continues to go down. And part of that is early on in this pandemic, we were testing primarily people in skilled nursing facilities and hospitals, those who are sicker to begin with and more likely to have complications. Whereas now we're doing much more broad scale testing in the community, particularly in workplace settings. Oregon, like the rest of the country, continues to have an over impact on some of our communities in particular our Latinx community, Black, African American, African immigrant community, Native American, Pacific Islander communities, and that mirrors statistics we've seen across the country. Much of that is due to inequities that occurred before this pandemic, some institutional bias, inadequate access to healthcare, more underlying medical conditions of those populations, and that continued and was amplified through this pandemic. So we look forward at OHA to continuing to partner with Lincoln County, local public health, your neighbors as we respond to this, and I stand by ready to answer any questions or any other additional information you need.
Thank you. I will just go through commissioners and see if they have any questions. Commissioner Hall, questions for either Rebecca, Nicole, or Dr. Seidlinger?
Not at this time. That was a great series of reports with a lot of information and a lot of positive steps. And I just hope the broadcast of this meeting and subsequent media coverage will help get the word out to people how hard everyone's working and how many resources are being brought to bear on this crisis. Thank you all.
Dr. Hunt, sorry, I promoted you. Commissioner Hunt, do you have questions for Dr. Seidlinger or Rebecca or Nicole?
Well, I have a comment and then I have a question for Nicole. And Dr. Seidlinger, really appreciate the information that you've provided today. Certainly it's data that is scientifically based and provides not only a perspective of the challenges in Lake County, but throughout the state and how we compare and how frankly successful overall I believe we've been in addressing this virus within the state. So again, my thanks to you for the information and my thanks for the really stepped up support that we're seeing from the state as we address this challenge. The question I have for Nicole, and I know you hit on this, Nicole, but one of the things that I hear a lot is somebody says, oh, I heard so-and-so who works at ABC company has got the virus, so I'm not going there. Can you address more specifically or help clarify that when somebody is identified as having the virus, they're not just allowed to wander around the county haphazardly? So I think that would be helpful.
Great. Yeah, that is correct. Once someone has tested positive with COVID-19, they're given really, really specific instructions on staying home. And we try and make that as easy as possible for people. We know it can be a challenge. You know, if I called you today and said, hey, you need to stay home for 14 days, there would probably be things you need like groceries or potentially like rent assistance, things like that. So those are all resources that we can help people with through our call center and through our contact tracing and case investigation process. Those questions are asked when people are notified that they're positive. In general, we like to talk, it usually takes about 3 hours for a case investigation because we really want to get all the information possible, but also provide people with resources. Before someone who is tested positive for COVID-19 can kind of go back out into the world, they would need to be asymptomatic for at least 72 hours or quarantine for 14 days.
And just one more point of clarification, that there is follow-up to try to help these people, which in effect encourages the continuation of the quarantine.
Yeah, certainly. It's not just kind of a one-time call from our CD nurses. There's continual follow-up to help monitor their symptoms and make sure that they have everything they need to continue staying home.
Okay, thank you. That's very helpful. And again, my thanks to you, Dr. Seidlinger, for the information you provided. Very, very valuable.
Yeah, and I have a couple of questions, first for Nicole and Rebecca, and then for Dr. Sendling. First is, you had said earlier, Nicole, that you had 11 contact tracers and that are bilingual. I think we started in phase 1 opening, I think with 3, but how many total contact tracers do we have at this point?
Total, we have, I think, 13 external contact tracers, so that are not employees of Health and Human Services. And then I'd say probably about 8 more who are internal. We definitely have more English-speaking contact tracers than we're using, just because that's not the need right now. The vast majority of our folks that are coming back positive are Spanish speakers, and so that's where the real need is. But we certainly have additional people if we get more cases that are English speaking.
Yeah, and I just want to say another thank you to many of our neighboring counties, as well as the state, that reached out to us. And as Nicole said, we have people that aren't employed by the county. Those are people that are employed by other counties or the tribe or the state that have reached in to help. So just a big thank you to all of them. And I hope at some point through this, we're in a position that we're able to give that help back. I also just want to point out that 3 hours for a case investigation at 120 cases, that's about 360 hours. So that is just a tremendous caseload that our public health nurses, everyone is working on. I also want to say that you had mentioned earlier that as of today, our resources to help families and quarantine, but as well as if you needed a place to quarantine, we're up and running. I just wanted to point out that a lot of those actually have been up and running for a while, not just today. We actually have had the ability through some hotel room agreements and stuff to put people in quarantine previously, and actually had been using those. My next question is on these mass testing events that are planned for later this week. I believe I know the answer to this, but just want to double check that we have transportation set up for people that need to go to those that do not have a vehicle or a way to get there.
Yeah, 2 out of the 3, we are coming to them. So the Project Trace, people come to your house, and then for the long-term care facilities, that's going to be done at the actual facilities themselves. For the event of the mass testing, yeah, we do have some transportation support. People are also able to walk up if needed. And we feel like we've gotten kind of 1 vehicle per household was our rule, but then we had some additional transportation support if needed.
Okay, thank you. And then just a comment, I think it's either Friday or over the weekend that our joint information team kind of released that we're no longer going to be doing daily case counts and for people to go to OHA to get those. But I just want to tell the public that's been kind of upset about that or didn't understand it, that we are now going to continue to do those. And my understanding is those counts will still come out of Lincoln County HHS at about noon every day. So that information will still become available. Of course, it is available on OHA as well. And then my questions for Dr. Seidlinger. One is, you had said previously that at this point in time from a state level, that you weren't looking at sliding a county back into phase 0, if you will. I think us being, the leading caseload in the state at this point certainly brings up a lot of questions for the public, but also for me, if phase 1 is kind of the appropriate place for us at this point in time, or if there's certain things that we should be maybe changing about us being in phase 1. My mind maybe goes to, that gatherings seem to be a potential issue for spread. We've already seen an outbreak from a gathering in this county previous to Pack Seafoods. And so I guess I would just like your thoughts on sort of that phase opening and specific to Lincoln County and where we're at in phase 1 with this current outbreak.
Yes, thank you for that question. I think, these are some difficult decisions kind of in front of you as policymakers, the governor as policymakers, that as we've moved forward, I think, as you've heard, we've been very successful across the state in controlling the spread of disease. And I think most counties that is still the case. The Lincoln County and some of the other counties that have had some of the highest case rates are really driven by some outbreaks. Some of that has been in congregate living facilities. In the case of Lincoln, it's been in workplace settings, which we've seen in other counties. Receiving this large a number of cases all on the course of 1 day or 2 days would have overwhelmed any of the health departments in the state. And so I think, as I said before, while it maybe wasn't as quick as we would have liked, the local public health authorities, tribal public health, and OHA did step up, and you're right, that was an amazing lift on case investigations by Lincoln County Public Health and getting these done. I think, the other place that we're truly seeing spread is in some of these social gatherings and other family and friend get-togethers. And I think, how do we step up our effort on risk communication to get people to understand that even a move into phase 1, which many people equate with a kind of we're out of it, we're in the clear and we can get back to normal, doesn't mean that. The coronavirus is going to be with us in Oregon and across the United States for many months, if not a year or more, until we have a vaccine. And so how do we kind of change what normal is for us as we go out? That we are doing the most we can to protect the most vulnerable residents. Some of those are elderly and folks with underlying medical conditions in chronic care facilities, where we've seen devastating impacts and about half of our fatalities across Oregon, and that's mirrored in many states. So some special protections there for our seniors and folks with underlying medical conditions in the community, that they have some additional steps that they can take to kind of limit their exposure. But then for all of us really to have some, take some steps in helping not just to protect ourselves, but really to protect others when we go out, because even without symptoms, we're able to spread the disease. The idea of maintaining that physical distancing and using face coverings is very important. And so in some respects, it's a little bit independent of the phase that we're in. So certainly the gathering size plays in there. And the smaller gathering sizes are much easier to contain, much easier to do contact tracing on, but then having the workforce of how do we kind of, for lack of a better word, police or monitor that and make sure that we're not seeing increased gathering sizes or potential for spread. Right now, we are not seeing significant spread within some of the business settings that open to the public, with restaurant patrons not seeing significant spread. I know we've had significant spread in Lincoln County amongst restaurant workers, but that doesn't appear right now to be due to kind of the work at the restaurant, but maybe due to other workplace or social settings. Our gyms and some of the other settings that haven't have opened also don't appear to be contributing significantly. So how do we message to the public that some of the things they can do to protect themselves are typically activities that occur outside are safer than activities that occur inside? Kind of keeping 6 feet away from folks, particularly those who aren't in your household, is safer than being nearer to folks. Limiting the number of people you have contact with, so having a smaller social circle, at least physically, over the next month, is better than a larger social circle. And while some of us may equate GoToMeeting and Zoom with work, how do we incorporate that into some of our social lives when we're at home? That using face coverings or masks when we're out in public is something we can do to protect those around us, and is a sign of protecting those around us. So wearing a mask is safer than not wearing a mask. Those are some of the, I think, things that we struggle with. How do we get that communication out to the general public, have people follow that advice so that we don't have to think about, moving back en masse to an earlier phase or cutting down gathering sizes. But those are certainly tools in our toolbox. And, in public health, we look forward to supporting, communities where they are. And if we can't get control of the spread with some of the risk communication and working together the way we have in the past, and we can't adequately investigate our outbreaks, what are those options on the table? And that could be limits in gathering sizes, even limiting some of the sectors that may be open, or staying where we are for longer than we had planned to.
Okay, thank you. And then my other question you kind of alluded to, but just ask it directly. And obviously this is just beyond Oregon, but I figured you're probably tapped into both the national and international scene on this, but we're obviously going to be at this for quite a while. with this virus. And my question is really, when do we think that a vaccine or treatment might be on the horizon? And Governor Brown's kind of phase 3 said we're not getting there till there's a reliable treatment or vaccine. What's kind of where are we in terms of that research process for those things?
I think some of the most optimistic estimations for a vaccine put it towards the beginning of the next calendar year. Certainly, there are some projections that are pushing that for sooner. But when development of a new vaccine, where we are already with a COVID-19 vaccine, is we've gotten here significantly faster than pretty much in any other vaccine. So some of this work, preliminary work around a vaccine for coronavirus had been done with SARS several years ago, which was another coronavirus. So there had been some groundwork done in trying to identify specific targets for the vaccine. So the first thing, our scientists have to do is find a protein or something on the vaccine that they can create a vaccine that'll allow the body to react against that. And then that's tested in very small trials, often in the dozen or a couple dozen range, to see how that does at producing antibodies and does it create the reaction that they're looking for. Then that's often done first in animals and then in small groups of humans. Then the larger trials have to happen, which is where a couple of the vaccines are moving towards right now, called phase 3, where it's given to larger numbers of people to determine safety. Safety is easier outcome to look at, making sure people don't have side effects or other effects from the vaccine, and then efficacy, how well does it work. And so that requires typically 30,000 or more people as they're out in the community and exposed to the virus. Do people who got the vaccine versus the placebo, are they less likely to get the vaccine? And it takes significant numbers of that because we don't have a lot of disease in the community. So even though, it may seem like, everyone in Lincoln County has the disease because we talk about it so much and the case counts are so high, it truly is a small number of folks who are impacted, even in a community like Lincoln County, across Oregon and across the United States. So it takes some time to get that data. So that's what kind of pushes me out to at least the minimum of early next year, but we may be looking at closer to summer or even later next year. The other piece that can help move forward is a very effective treatment. Right now, we have a medicine called remdesivir that seems to be effective at shortening hospital course and improving outcomes in those who are most seriously ill in the hospital. That drug is available in limited quantities and has been distributed out to Oregon hospitals as needed to treat the patients we currently have and some on hand to treat future patients. The supply chain there is not great, and that continues to be doled out to states on a limited basis. But the other thing that could help is if there's a treatment that could be given to someone who tests positive that could prevent their complications as an outpatient. And right now we don't have those therapeutics, so we know that we have multiple pharmaceutical companies working on that. So that's where the messaging about where we are in phase 2 is kind of where we will be until there's a vaccine or effective treatment. That doesn't mean that OHA will continue to look at the spread of disease in the community. If there are settings that are deemed safe, that we're not seeing significant spread, where we think additional guidance could be loosened, that we wouldn't make those recommendations to the governor and that she would likely put those out. That's things like gathering size or some other businesses where we may be able to relax some of the measures that businesses have to bear in terms of keeping people apart and other things. So we'll continue to look at the spread of the disease throughout the summer and into the fall to see where that can change. The other thing we do have to keep in mind is that as we move through the summer and at the end of the summer and into the fall, is that's when students are typically coming back to school. So our K-12 schools, as well as our colleges and universities. And we know that, while coronavirus and our mitigation measures have had a tremendous impact across society, really with our students having to move to distance learning relatively quickly, that there was an uneven access to education over this spring, and that we really want to try and safely get students back in front of a qualified teacher so they can continue their learning. And that's from our youngest students who really do value, each year in a school year, the amount of learning that they do is tremendous. And as parents, we're our children's first teachers, but we're often distracted teachers who are trying to work from home and do other things. And so how to get them in front of qualified teachers, I think, is something that we're working on. And so knowing that as we come back to school in the fall, that's going to be a tremendous change on where we are in terms of potential spread in our community and other things, and also may impact our public health response as we respond to students or staff in schools who get sick. So I think those things are weighing on the cautious approach of moving forward. You'll hear from many other states that have moved through to phase 3 or phase 4 or other phases. Their phases tended to be much smaller than our phases. And remember that often some of those states really started from a state, not just to stay home, save lives, but almost a lockdown with virtually no businesses open and leaving the home only for very essential services. In Oregon, we had several more businesses, some more manufacturing, construction, other things even open during baseline, with childcare open to essential workers during baseline, which wasn't the case in all states. And so kind of our baseline was really where some states moved to in phase 1 or even phase 2. And then our phase 1 did open up several businesses. So I think we have to keep that in mind when we compare to other states. We can't just compare the numbers. But I think we do have to keep that in mind as we are, as the counties who moved into phase 2, yes, that's kind of the end of the numeric phases until a vaccine, but we'll continue to monitor it and hope to move some of those forward. And we may even tweak phase 1 guidance if counties are staying in there longer, or other guidance that needs to address things broadly. I don't know if that answers the question or not.
Yeah, thank you. That's helpful. Any other questions from Commissioner Hall first before we move on?
Yes, thank you, Chair Jacobson. I think not directly related to some of the aspects. Well, on the question of quarantine, I was reviewing my notes of public questions and feedback, and one thing that's come up multiple times from members of the public, essentially asking the question is, if I understand that quarantine is voluntary, but the question was, if somebody on 14, we learned that somebody on 14-day quarantine has violated that quarantine, whether or not there's any consequences for that.
This is Dr. Sadling. I can start with that if you want, and then defer back to your local public health partners. I think what we've seen throughout this outbreak is we've had very great cooperation for those who are sick and staying home in isolation, and those who are potentially exposed and not showing symptoms staying on quarantine. We know that's not the case for everyone, and for some members of our community, there's a tremendous struggle between the need to go to work and to kind of get a paycheck and pay the bills and stay home. And that's why you heard from your local public health staff about the importance we place on trying to bring social services to them and find out what they need. That our staff, our communicable disease nurses, and other staff who do case investigations are very good at trying to engage individuals, not just in their own language, but in a culturally effective way to try and get them to stay home. Not everyone, heeds that, and so, we do everything we can to do that voluntarily. If that person is, someone who is at home in isolation having symptoms, and for example, they work in a long-term care facility, we will work with their employers to make sure that they can't go in, because we know that would be a high-risk setting. If they're going out and going to the store and things, well, we don't like that, we'll continue to talk with them and try and work with them. During this pandemic, the only time we've had to resort to any higher level powers, meaning some legal authority, is with the federal isolation and quarantine orders that were issued as folks returned from China, other high-risk countries, and cruises were placed in federal quarantine until they could come out into the public. We have not had to use specific quarantine orders across the state or in any of our counties. Our public health partners at the local level have been very good at trying to engage people. There are those exceptions to folks who really don't stay home, and it requires a lot more work from our public health partners, and we take those on a case-by-case basis, trying to continue to get them to work to stay home. And I don't know if Nicole or Rachel want to add anything there.
Or perhaps our legal counsel, Wayne Belmont, might want to. I know that he did some legwork on looking into that issue as well.
Well, actually, I think Dr. Seidlinger hit the nail on the head perfectly here. There are some legal mechanisms. There are quarantine and isolation orders that can be sought from the court, and we'd actually already had some discussions with the court in case those were necessary. Makes it a little more difficult in our current situation with some of the linguistic and cultural issues. But first and foremost, what we want to do is we want to see if we can't get voluntary compliance. And I do know we've had at least one situation that that's my office has been called in to assist with, and we've found ways to work around and actually get compliance in that particular issue without having to resort to the courts. Courts are absolutely the last area you want to go to for something like this. And again, we have seen a lot of voluntary compliance.
Thank you, Wayne. Commissioner Hunt, questions from you?
No more at this time.
Okay, thank you. Now, and if Dr. Seidlinger, if you're able to stick around for the face covering policy discussion, I think that might be helpful to us if you're available.
Yes, I can stay on.
Great, thank you. So next, we're kind of jumping into our continued discussion about public face coverings. Just to kind of pick up where we left off, it is our basically, well, I should say Wayne Belmont, our legal counsel, had looked into this, and if the county board of commissioners passes an order on face coverings, that order would only be usable or good inside the unincorporated areas of Lincoln County, which is not where our population centers are at. So we would need cities potentially to pass something similar, or hopefully the same order, so that we have consistency across those various jurisdictions. Wayne, is there anything you wanted to add to my condensed version of your explanation?
No, I think that was a good explanation. We have been looking at what other jurisdictions have been doing, both across the state and across the country, actually. This has obviously been an issue that's of a political nature as well as a public health nature. And so we've been really trying to focus again on the directives that you've given us as the Board of Commissioners to make our decisions based on science and data. And I wanted to actually extend my thanks to Dr. Seidlinger. And I'm not sure if we actually introduced him properly. He is the state health officer and state epidemiologist for the Oregon Public Health Division of the Oregon Health Authority. So right at the very top of the state's people that gives us advice and guidance on these particular issues. And I know during our discussions here, I think it's helped me to when I give you some specific recommendations later in this meeting, to really guide me in looking for solutions here that really advance the real purpose of what we're doing here, and that's to control the disease.
Thank you, Wayne. I believe we've got several pieces of public comment that have come in relation to face coverings and some other stuff. I think either Janet or Kristen, or excuse me, Christy, can you guys read us kind of the, I guess, the Cliff Notes version of that public comment?
Yeah, I can go. Hi, this is Christy. So far, what we've been seeing with the public input, it's nearly unanimous for the request to require face masks. We've had a few requests for the county to go down to phase 0. We've had a few requests for removing the 24-hour lodging hold, and concern for contact tracing, and one request to move into phase 2.
Okay, thank you, Christy. I guess before we, jump into our continued conversation on face coverings and hopefully take some action there, there's been a lot of information and misinformation and changing information on face coverings and face masks presented out by, OHA. Actually, your guys' hasn't been that confusing, I would say, but from the World Health Organization and other entities. And I feel like it's gotten very confusing. The information has changed. And so I guess I'd point to you, Dr. Seidlinger, and say, can you give us a sort of a summary of what we know about face coverings at this point in time, in terms of data and what they do and if and why they're important?
Sure. Let me start with what people think of normally as kind of masks or face coverings when we talk about communicable disease. What our nurses and doctors wear in the hospital tend to be very specialized equipment, N95 masks, other respirators that protect the individual who's wearing it. They're highly regulated, tested by the FDA to prevent that person from being sick. What we're talking about for face coverings for the general public are kind of surgical masks, other paper or cloth-based masks, even a bandana or scarf can do. And when that's placed over the mouth and nose, that can prevent the individual who's wearing it from potentially infecting others. As I said early on, we know that there can be spread from folks before they develop symptoms. We call that pre-symptomatic. Some studies have shown that the amount of virus that's in the airway in the 2 days before someone develops symptoms is the highest. What we don't know if that translates into the highest time to infect others, because we know that coughing or sneezing can certainly propel the virus further. So that face covering can help to contain someone who doesn't have symptoms as they're breathing and talking from spreading the virus, because that cloth, that paper can catch a big part of the virus. Early on in this disease, we didn't know about the amount of spread from people without symptoms. And so face coverings weren't something that was talked about early on in this disease. But as the science has progressed and we learned more, the face covering recommendation kind of became accepted. And more data has shown us that face covering really can limit the spread of the disease. Again, I think, there are varying levels from folks who say wear a face mask all the time when you're out in public to wearing it when you're in the highest risk situations. Those higher risk situations is when you're closer than 6 feet from someone else, particularly for a prolonged period of time. We think of that as 15 minutes or more. And so in some of the indoor settings that are open to the public, in the statewide guidance around face coverings, it is required for employees in those settings, and those employers are required to provide them to individuals. The recommendation for customers is there, but not a requirement, and many stores and other businesses do provide them to customers as they come in. But by wearing that covering in those settings, it's a way of protecting those around you. So it's kind of an act of kindness and altruism that we all need to do to protect each other, because it only works if we all do that. In just passing someone on the sidewalk, not stopping to talk when you're outside and you're more than 6 feet from other people, certainly that face covering doesn't provide as much protection, because the actual physical distancing provides the protection. We know that those face coverings can't be worn in restaurants by people who are eating or drinking, and that's why restaurants are kind of considered one of the higher risk places for transmission, and why there's some strict rules around the physical distancing that needs to be maintained in those restaurants, and why many localities are opening up more space outside of restaurants where the tables can be spread out more, and we know the risk of transmission is lower outside. So that's the general overview on face coverings. They've created a lot of passion on both sides of the face covering debate. And we feel like that currently with the recommendations, we've had pretty good compliance, but we know it could go further. And that's where the discussion about requirements for more than just those employees in certain settings has come in. And certainly, some of that happens on a local level, but that's the broad overview of face coverings in Oregon and the science behind it.
Thank you. I'm hoping that kind of makes it easy for the public to understand where we're at currently with information and data on face coverings. Appreciate that. So now just kind of jumping into stuff. Wayne, do you want to take over from here, or do you want me to kind of do more framing?
I'd be happy to maybe provide you a little information on what we've discovered in looking at this particular issue across, again, the state of Oregon and in other places in the country. So first of all, at this point, there is no jurisdiction, at least that I'm aware of, that yet in Oregon has adopted a specific requirement for face coverings beyond the guidance and regulations that are put out in the executive orders. There's been a lot of discussion about education and a lot of focus on expanding the education on what's provided beyond that, which is coming from the state. but nobody has actually adopted any regulations. We've had some discussions with some of our counterparts. They say that this is actually a topic of discussion, but nobody has yet taken that step. We looked at some what's been done in some states, other states, and it's really all over the map. You have California as one example where the state has not adopted any statewide regulations, but has left it up to counties. A number of counties in California have adopted specific face covering requirements, and a number of counties have elected not to adopt those. In those counties that elected to adopt the requirements, you have some cities who've indicated to the county they're unwilling to enforce the regulations. Enforcement, as you've heard in our previous discussion, is a really difficult issue. In other places, you have a lot of support for enforcement. And that's sort of the pattern you see across the United States. I do know there's been at least a couple of states. Ohio is a classic example, I think, where the governor adopted an executive order to actually have face coverings required across the state on an evening, and by the next morning had already rescinded that order. And others that have really stuck to their guns in terms of this is what we're going to require, and actually done a lot of enforcement around that. So it's all over the map across the United States. One of the areas that we looked at that had a very interesting approach to doing this was the state of Washington and a number of counties in the state. And it's one of the things that I want to suggest to you, you might want to consider. There, it's not driven by any kind of political decision-making process. It's really a public health process. And it is the public health officer or public health director who has issued a directive for people to actually continue to wear face coverings in appropriate circumstances. It's an interesting feature in that this is a self-executing order. What that means is, while it is a directive from the public health officer, there really is no specific enforcement around it. In fact, the directive says a couple of very important things. And this is actually something that I would recommend anything we do focus on as first and foremost, and that is that face covering does not, and I repeat, does not replace the already the guidance that's out there about practicing physical distancing first and foremost, to continue to practice hygiene, clean your hands as much as possible, and staying at home as much as possible, especially if you are sick. So you put those things up first as the first tools to use in the toolkit, and face covering is just an additional tool when you actually have to be out and among other people. It also does not replace any of the directives that are already existent in the state or other local regulations there. So it really supplements the rules and regulations that are out there now. It makes it pretty clear that it is a directive, meaning that it is something more than simply a recommendation. It's what the local health authority says you should be doing. But they don't actually engage in any kind of, they're not stopping or detaining anybody for failure to meet it. They don't issue citations, arrests, and in fact, that's clearly articulated in the orders that are issued. And they say that these are used to educate, encourage, and persuade individuals to wear face coverings. And this has again been adopted by a number of counties in Washington State, and it's something that I've had discussions with Director Austin, and I think it might be something that we could do here. In terms of other requirements you might want to make, I know that I've heard repeatedly that we need to protect our most vulnerable population, those who are at risk either because of medical conditions, possibly those who are over 65, others who may be more susceptible to actually worse outcomes for the disease if they catch that. And those people need to continue to be able to access essential services. And those essential services include their medicines and groceries. So one of the things we could do is institute requirements in those areas to protect people as they enter those particular areas. So having a specific face covering requirement, it exists out there in some part for employees of establishments that are in those areas, but not for customers. So we could do something that would make that a specific requirement in pharmacies and groceries. And if you do so, I would actually recommend to you that you do that in larger grocery stores, so those over 2,500 square feet in size. The other thing that I've seen universally across the state and in other areas is really increasing the educational component of what we're doing here. And I know locally, at least one jurisdiction has already instituted that, and that's the city of Lincoln City. And I know Newport, city of Newport, has that on their agenda tonight to really do some education that goes beyond what we're currently putting out there through our public health process. And I think that's part of what this can be, is an education process to do that. And then if we want to apply this within the city limits, we can use the model that we did with the lodging regulations we put in place. And that is, we can craft an order that incorporates the changes that I recommended here, and also allow for the concurrence of the city, so that that would apply inside the city limits. So that's, I think, what we've been looking at across the state and the United States, and some recommendations that you might want to consider as you move forward on this.
Thank you, Wayne. I have my own thoughts on this, but I will let the other commissioners go first with just where they're at and what they're thinking. So Commissioner Hall.
Ooh.
You're on mute. Go
Yeah,
ahead.
I'm unmuted now. And this is probably been the thing that I have had the most contact from the public about, and have been thinking about the most. That, you know, I would say probably 2/3 of the people I hear from or more are extremely passionate about us doing such a policy. I know there are strong pros and cons. I think it is abundantly clear that this is one of the best tools we do have to contain the spread. And while a lot of people are voluntarily complying, there are significant numbers who are not, whether they simply don't believe that it's beneficial, they consider it an infringement on their personal freedom, or something else. But just something else I want to throw in, because I have, among the people I've talked to, I'm going to say 3 business owners in the last week who essentially said to me that they weren't going to do a mandatory face covering policy in their stores because they feared pushback from customers on their employees. They said, however, if you make it some kind of government directive or mandate, then I absolutely will enforce it. You know, essentially making us the bad guys. So, you know, I'm taking that into account as I think this through. I also think of an analogy I heard on one of the calls I was on this past week, which was they thought of face coverings much like the speed limit laws of this country. We do have speed limit laws. Not everybody obeys them. A significant number of people do. Many people violate them. Not everybody who violates them is caught. Nevertheless, some people are. But just because we don't have universal compliance, or don't have enough resources to fully enforce the laws, you know, catch every violator, that we don't consider that a reason to repeal speed limit laws, or somehow say they are voluntary guidelines and not the law. So this is what I am weighing right now.
Okay, Commissioner Hunt.
Well, I think it's pretty clear that face covering help limit spread of the virus, and I think it's appropriate to take some action in recognition of that scientifically based data. The question is, what's an appropriate action for this board? I would support a directive from the Director of Public Health. I think that is certainly something that can be done that would be a step in the right direction. I'm willing to look at mandating face coverings. I think with some limitations. I think Dr. Seidlinger pointed out that outdoors in the public, that sort of thing, there really isn't strong evidence that that's where the virus is transmitted, but it is transmitted indoors and at gatherings. If we consider that, though, I think, as I believe Chair Jacobson, you've already pointed out, if we were to mandate coverings under whatever conditions, really would only be effective in the unincorporated areas of the county, which
Oh, we lost you, Commissioner Hunt. Oh no, I think we lost Commissioner Hunt.
Commissioner Jacobson,
Yes.
could I jump in with a question for Dr. Seidlinger? And I don't know if he would want to weigh in from a medical perspective or not. Here's one concept that I have heard, again, trying to listen to a multitude of perspectives on this. Particularly, I think one of the highest populations with highest levels of concern about community spread are our senior citizens, for understandable reasons. So one person said to me, and the little light bulb clicked, well, I don't have to go to the salon, I don't have to go to the restaurant, I don't have to go to the gift shop or candy shop, but I can't survive without food and medicine. So what if you just made face coverings mandatory in those businesses? And then again, I know that drive up and delivery services are available from some of those businesses, but again, the availability of that, I'm hearing mixed messages. So I don't know, would any of our public health people want to weigh in and say, would that be a step that would be supported by science, or would it simply be, kind of a feel-good thing?
Can we pause for just a second, Commissioner Hall, and make sure that Commissioner Hunt is able to talk again, because we sort of lost him.
Of course.
Commissioner Hunt, are you able to be heard? Can you say something? Shoot, I think we lost him. Well, if you can hear us, Commissioner Hunt, I don't know if you want to try dialing in again or dialing from a different place in your house, but we cannot hear you.
Yeah, because I think I can hear him really faintly in the background, but it's not loud enough to be intelligible.
Okay. Oh, I just see Doug Hunt has arrived, so hopefully.
Okay, I've dialed in. Can you hear me now? Okay,
Great.
I turned my computer off, although I still have video. Let me turn my mic off on the computer. Okay, now I'm on my phone. I don't know if you can see me or not. Looks like my camera's turned off on my phone, but you can hear me better now?
We can hear you better. Thank you.
Okay.
All right. So Commissioner Hall had just asked a question to Dr. Seidlinger and Public Health, and I'll go ahead and let them answer that now that we have you back on.
Yeah, I could hear Commissioner Hall.
Okay, go ahead.
So Rebecca or Nicole, do you want to go first, or do you want me to take the first crack at this?
Oh, please go ahead, Dr. Seidlinger. I'm sorry. This is Rebecca.
I was going to say, I'll take silence as okay. I think, there's definitely different ways to approach face coverings, and I think there's a gradation there. As I said, as Wayne kind of laid out, the physical distancing is the most important part. If we can keep our distance from others, That's the most important. And then using the face coverings when that piece is not available. Indoor spread is much easier than outdoor spread, and that's why a lot of face covering requirements are really focused on the indoor areas. Certainly some of those essential businesses, the places people need to obtain services from, even though, as you said, some delivery services are available. Pharmacies and grocery stores, fit into that where some of our other businesses don't. So that could provide some protection to older adults and those with underlying conditions who have to go to those places. Is the requirement for people to wear it. As people wear it, it protects the individuals in there. Again, the current framework in Oregon is with the requirements falling on the employees, because then it's written into the EOs that, or into the guidance that the employers then provide those to their employees with a voluntary for customers. That certainly nothing in the EO precludes, and I think the governor's even encouraged that if a locality wants to institute something higher, which is what Lincoln County is considering, or if a business wants to require it for customers, they certainly are allowed to do that with the encouragement that that business then provides those masks to individuals. The one location where masks are required of customers, or face coverings are required of customers, is in mass transit. And part of that is because there's very limited ability to do physical distancing on mass transit. And you can't do mass transit outside. You're by definition in the bus or in the train. And the airflow isn't great. So certainly, having a requirement for customers in those select settings does offer some protection, and then individuals can kind of choose their risk, so to speak, if they want to attend some of those other businesses or go to some of those other businesses that may not have the requirement. But there certainly is a spectrum of approaches that can be taken. But what the science does show us is that utilizing a face covering does help prevent the spread to others, and that's why the recommendations and requirements are fairly widespread across the country.
Okay, thank you. I guess I would just kind of provide
Rebecca, can I just add one other thing? Since our outbreak is really affecting a lot of the workers in these places, that it seems to me like it would be kind of a safety net for them if we did require, at the very least, that people that worked in the workplaces and couldn't maintain 6-foot distancing, that it would be mandatory for them to wear face coverings.
I believe that, Dr. Seidlinger, isn't that already state policy that in most workplaces, or all workplaces, that is a requirement?
There's select businesses that are called out in the executive order, and I don't believe kind of food processing are some of those. Restaurants, grocery stores, pharmacies, other retail, gymnasiums, and other businesses are specifically called out, but I don't believe food manufacturing is. I can look it up really quickly, but Wayne may have it at the tip of his fingers as well.
I am looking as we speak, so I don't have the answer right now.
Okay. Well,
we'll see who's quicker at Googling.
I think if food processing is not covered, then we obviously need to work on that one. But I would say, in terms of what we had already talked about today, in terms of a strategy for face covering, to share where I'm at, while I like the idea of a directive, I don't feel like a directive provides anything more than a recommendation, which we already have in place. Really does. I don't think that it has the teeth for what we need right now. Always a fan of education. Education can still happen, and I feel that needs to be increased. I like some of the stuff that Lincoln City has been doing that we can emulate, and especially getting our cities on board to emulate that obviously have more people than in the unincorporated areas. But I do feel we need to pass an order. I think, at least for now, specifically targeting where there is a lot of people that are inside, which is where there's potentially more spread, and especially things that you have to do. You have to go to the grocery store. There are some locations in the county that don't have a curbside service or a phone app that you use to order ahead of time. There's some locations where you actually do physically have to go into the grocery store. There's also a lot of delay in those ordering services. You sometimes have to put in a week or 2 weeks out to get those. So I think inside stores is really important, as well as pharmacies, because people do need to go there. Obviously in the unincorporated parts of Lincoln County, you know, that order, while we do have a grocery store in the Lincoln Beach area, and we do have a little Logsdon store out there, the majority of where that would be most impactful would be inside cities. So I guess what I see is I am fine with either us, the Board of Commissioners, discussing and hopefully passing an order into the unincorporated areas today, even though that's not super impactful because the majority of our stores are not in the unincorporated area. I feel like at least we protect the citizens shopping in those places, which we do have. I think it also sets a tone for cities, and hopefully we write some kind of order that cities could take off the shelf and then just emulate. And then, or the other approach I'm okay taking is that we try to schedule a meeting for this week with our cities, as we've done in the past for lodging, and basically discuss passing an order together. I think it would be really important that either if we do step A, us pass it and get that to cities, or step B, we do that all together as one unit, that we have a consistent order hopefully passed. I think it would be very confusing to have a different order in different places. That's confusing for the public. And then 3, my understanding is there is some state conversations about potentially an order, or maybe that's being discussed. And so, you know, that could obviously drop too. And then that kind of changes what I said about 1 and 2, but I'm fine with either us passing in unincorporated areas today, or at least discussing that, and hopefully passing, or having a conversation with cities later this week and hopefully passing the same order. That's where I'm at.
Madam Chair, usually I think we try to make, usually I think we try to kind of reach consensus and then, you know, shape a proposal. And because of the speed and the complexity of this, I think we're, you know, my sense at least is that we're still moving toward that. But could I put out a motion, and if one or the other of you would be willing to second it for purposes of discussion, I'd just like to get it on the table, free, you know, and of course we can modify or not move forward. And if we're not in a consensus, I would withdraw the motion. But how about if I make this motion?
Commissioner Hall, before you make a motion, can I ask our county council a question?
Sure.
Okay. Council Belmont, I know several of us, including yourself, have had some conversations with cities, as you said in your report earlier. I think the city of Newport is meeting just in a couple hours to discuss, and I know that Lincoln City had discussed this issue a couple of weeks ago and came up with kind of an educational plan. But do you have some idea of where the other cities are at besides Newport and Lincoln City in terms of discussing this or taking possible action?
Well, we did in our cooperators call last Friday talk about the fact that the board would be discussing face coverings and there could be some action. So they're aware, generally you're going to have this discussion and possibly move forward. I think there is, while they didn't commit to saying which way they would actually vote on something, I think there is a lot, they're hearing the same things from their constituents that you are, that this is something that needs to be discussed. And if we do move forward, it'd be great, as we've done in the past, to move forward with a unified approach across the county. So I think that if we set something up like we did the last time, and we actually were looking at a time possibly this coming Friday at 1:30 to bring together all the elected officials across the county for another countywide discussion, I think you'll get some good participation in that discussion, and we can see where it goes.
Okay, thank you. And I would just add that whether or not we pass something today or we wait for all of the cities, I would volunteer myself to help kind of facilitate that discussion and process. I feel like after doing this 3 times, I'm getting better and better at it, hopefully. So I'm willing to do that again, even if we pass something today and we're already kind of done. I'm happy to help kind of organize that and facilitate it. All right, now Commissioner Hall.
Commissioner Jacobson, yeah, first off, regarding the Friday meeting and you facilitating, I think that is a wonderful idea, and you are indeed Lincoln County's master cat herder. The motion that I wanted to offer, you know, frankly, I don't think we've ever done this, but I think other public bodies have. And I'll just, you know, I am literally writing out of my head. Motion. It is the sense of the Lincoln County Board of Commissioners that some form of a mandatory face covering policy is a necessary step to help protect public health and slow the spread of the COVID-19 coronavirus. Because of our desire to have a consistent county-wide policy, we are going to convey this sense to our city partners with the hope of developing consensus on a policy that the cities would join us in adopting. End of motion. And is that clear? In other words, it's basically saying our board believes this is the right and necessary thing to do, but we really need our city partners to be on board with us as well for it to work.
I think I heard Commissioner Hunt try to speak, so go ahead, Commissioner Hunt.
Well, I'll second the motion, but I got interrupted due to technical difficulties, and there's still some things I'd like to say. Number one, my support for a directive is the fact that I feel that is the strongest thing we can do quickly, that at least sends a message to the public in general that face coverings are important. And until we can get more jurisdictions together to make our face coverings mandatory under certain circumstances, I felt a directive was at least a strong statement that we could make quickly. Second of all, as I was saying, and I don't know where my technological difficulties developed, so if you hear me a second time on the same thing, I apologize. But I think that there needs to be as much uniformity as possible through the county. So I certainly support a Friday meeting or a meeting whenever we can get all of the jurisdictions together to discuss face masks. But another aspect that I'll throw out, and I think it would be an appropriate topic for the work session that involves all 7 cities in the county, is possibly limiting gathering size. You know, that was the second or first thing that Dr. Seidlinger mentioned. You know, the 2 things that can be done are limiting gathering size and use of face masks. So if we're going to talk about face masks, I think we should talk about limiting gathering sizes too. So that completes my thoughts. And again, I certainly second Commissioner Hall's motion.
Madam Chair, could I jump in again? Because I think Commissioner Hunt is making a lot of valid points here. And again, this isn't standard parliamentary procedure that usually a friendly amendment comes from somebody else. But Commissioner Hunt, please let me know, would you accept a friendly amendment, which would be to amend my motion and essentially make what I said the second part of the motion, but put up top that we, as the local public health authority, are directing our public health director to issue a directive along the lines of what we've been discussing as an immediate first step.
Commissioner Hall, any motion or amendment that you make would be considered friendly, so certainly agree.
Thank you.
Okay, we have a motion and a second. Still in the discussion phase here, I would say that I agree, Commissioner Hunt, that you make a valid point on the directive is actually something that we can do today. why I still don't know how much teeth it has. That is a step we can take today to protect the public. And then let's try to get that joint meeting with the cities for Friday of this week. I think gathering sizes is something we need to discuss. It's been something I've been thinking about. I also think by Friday we might have some additional information coming out. It might be a little early for all those the large testing we're doing later this week, but we might have at least some of those tests trickling in, so we might know what we're looking like on that end. And then additionally, something else to possibly discuss with our cities, or at least some of our cities, is a lot of feedback we're getting on that 24-hour hold in hotel rooms. I know we discussed that last week and decided to stay put on that, but we are getting quite a bit of feedback, probably just as much feedback on that than we are face coverings. So that might be something we want to discuss with the cities that still have that. And in fact, some do and some do not. So with my thoughts out of the way, I guess it's time to go ahead and vote.
Commissioners,
Yeah,
I'm sorry, can I get a clarification? Just a
Yeah.
clarification. This is Wayne Belmont, sorry. In terms of the scope of what you would do, because I'd like to draft up actually some documents related to this now. I think I know what I can do with the public health directive. That's pretty easy. But the limitations, are you talking about just for pharmacies and grocery stores? Or are you talking for more than that?
Madam Chair,
Yes.
may I suggest again, because perhaps to give at least a couple of options to our city policy partners to consider, that we present both alternatives to them that say it would be our desire to have a, not 100% universal indoor face covering policy, because there always have to be certain exemptions, but and then if the cities are just not willing to go there, that the fallback would be to present a face covering policy only for groceries and pharmacies for the reasons already stated. Does this make sense?
This is Commissioner Jacobson. I guess I would look at that maybe a little differently. I would say that we start with let's see, how do I want to say that? That we start with the order as pharmacies and grocery stores as a minimum for discussion with cities, and that we have cities weigh in on additional things beyond that, rather than starting with kind of everything. I feel like starting with an order that has pharmacies and grocery stores, giving a draft of that order, hopefully, well, it's 4:30, so probably not today, but hopefully getting a draft of that order out to those cities today. Yeah, you're welcome, Wayne. Out to those cities today, so that they can start potentially adding or looking at the things that that they would want in that. That's maybe the approach I would want. Each community is a little different, and they might have certain venues or things or places that people go that maybe other communities don't have. And so I guess I would start with an order with pharmacies and grocery stores, send that out hopefully tomorrow, and then have cities start, and individuals on those city governments start thinking about kind of what else might make sense for them.
I'm absolutely supportive of that. So we've been way across the map here, but I guess the question would be, if we vote yes for this motion, Mr. Belmont, do you have a clear enough sense of what the sense of the board and the direction of the board is on this to proceed?
I do.
Thank you.
Okay.
So
Go ahead, Commissioner Hunt.
just for clarification, what I understand the motion relative to directives, but what concisely, because I know we've had a lot of discussion, what's the directive as far as face coverings? Are we mandating them in the unincorporated areas, or are we having a conversation Friday to further discuss mandatory face covering?
Commissioners, if I might, what I heard is I'm going to actually have a mandatory policy for the unincorporated areas that starts out with pharmacies and retail grocery outlets over 2,500 square feet. It will be able to be expanded if you want to go beyond that, and I will try to have some specific language, or we can identify sectors if you want to address it into other areas. We'll be able to do that if you so desire on Friday.
Okay, but again, this vote will mandate face coverings in the unincorporated areas in those environments that you identified, Councilor.
No, Commissioner Hunt, the motion that we have on the table, looking at my notes, is we have a directive, again, stronger than the recommendation from our public health director to wear face coverings while in public and in enclosed spaces. So that would potentially go today or tomorrow. That directive would go out. And then hopefully Friday, we would virtually sit down with all of our cities and discuss a mandatory face covering policy in pharmacies and grocery stores. That if we pass that on Friday would be in effect into unincorporated areas, as well as if cities pass that on Friday would be in effect in cities. Wayne will get that draft out of that order to cities tomorrow, and they could start also looking at beyond grocery stores or pharmacies, what other types of things they have in their community that would need to come under that as well. That's the order as I understood it and took notes.
Okay, that is helpful because I'm more comfortable with that process.
Yeah. So we are not passing an order for unincorporated areas today. We are passing an order that supports a directive, and then that says we are basically committed to do something and to have this this meeting on Friday to provide leadership to cities to hopefully pass something together.
And just to make it clear, the directive that's going to go out that we're going to actually send out tomorrow is sent by the local public health administrator. So that'll be under Rebecca's. I think we could actually incorporate Dr. Long as the health officer in that order, but that's something that she will issue.
Exactly.
Yeah. Can we get it out tomorrow on a Saturday?
If tomorrow's Saturday, I hope. I wish it was tomorrow was Saturday. But
it's Monday, Commissioner Hunt.
It feels like this is Friday. It does. But no, yes, I could work on that, and as long as I can get some time with Director Austin and then have Dr. Long look at this, then we can get that out tomorrow.
Dr. Seidlinger, I really do have my brain engaged. Sorry.
All right. Motion and second on the table. All in favor, say aye.
Aye.
Okay, motion carries. Thank you. I think at this point, if the other two commissioners are in agreement, I'm going to allow Dr. Seidlinger to go. I know he has other obligations he needs to get to, and I really, really appreciate your time. So if there's no objections by Commissioner Hall or Hunt, I will let you get off if you need to.
Thank you very much, and thanks for including us.
Thank you.
Thanks, Doctor. Your participation has been exceptionally helpful.
Thank you.
Commissioner Jacobson, could I also be excused? This is Rebecca Austin.
You were next on my list, and if
Nicole, thank you. Do you need me still?
Write that directive, Director.
I got people from Clatsop here that are clamoring for my attention, so I'm going to scoot off.
And if Nicole needs to get off as well, that's fine. I think she might have already left.
Nicole might have gotten off. I think she's in another meeting, so.
Okay, that's fine.
Thanks so much.
Participation.
All right.
I'll get with you, Wayne, tomorrow.
Okay.
Thank you.
Any commissioner reports?
I'm afraid to report anything.
Same here. I think most of what I have been hearing, working on, and thinking about has already been covered at this point in our meeting.
One commissioner report I have is just continuing to get some feedback from Otter Rock about visitors there, which is again, while we own part of the parking lot, it is a state park that's really drawing people. Not our parking lot isn't drawing people, the state park is. So talking with Dennis Comfort today, they are going to have someone else from state parks on their communications team really reach out and hopefully start providing kind of this better and more consistent communication to the residents and neighbors that are there. So hopefully that will help out just in terms of them communicating and kind of understanding what's going on, both with that parks, but also with neighboring parks that have a tendency to have kind of a spillover effect. The other thing I wanted to bring up is have gotten just a little bit of feedback about last week we decided to hold off on opening camping inside Lincoln County owned campground facilities. I'm inclined to stay close at this point, but I would want to bring that up next week after I think we have increased testing and hopefully have our arms wrapped around the current outbreak. I would think next week would be an appropriate time to reassess that if the other two commissioners are in agreement.
Yeah, I'm comfortable reassessing it. We'll have a better idea of where we're at.
Okay.
I am too.
Okay.
I am too. No, yeah.
Go ahead. Christy, could you please make sure that camping at Lincoln County Parks is on our agenda for next week? Thank you. And that's all the reports I have. Oh, I did see, I don't know if he's still here, but I did see Wiley hung on there through our long call. Wiley Thompson, is there anything you wanted to provide a brief update on?
Nothing really from me, Katie. I appreciate the cooperation I'm getting, and I know Casey's working real hard on social media. There's a big push from a number of folks to reach out to the Latinx community and to include mom language provision for information, and they're doing a big it's going to be Zoom, Facebook Live type event with Jesus Hernandez facilitating it. So that's going to be really good. That's about it.
Okay, thank you. All right, moving into decision and action items. Extension of the declaration of emergency related to COVID-19 presented by Wayne Belmont.
Well, Commissioners, this is actually the source of the authority we have for doing the regulations we're doing is the fact we're under an emergency. And as you may recall, we have extended the dates on the emergency several times. And this current resolution expires on June 25th, and we didn't want to wait until the last minute to bring that to you because given the current events that are occurring, that we think we need to extend it again, the emergency declaration. The state has their declaration out through July 6th. That is a Monday, and I don't want to have it end on one of your meeting dates. So our recommendation is that you extend the emergency declaration to July 8th, and we'll continue to monitor and continue to make extensions as needed.
Chair Jacobson, I move that we approve this resolution extending the Lincoln County state of emergency related to COVID-19 to July 8th, 2020.
I'll second it.
All in favor say aye. Aye.
Aye.
Any nays? Nope. Motion carries. Last decision and action item, COVID-19 emergency business assistance program forgivable loan agreement, OBDD contract. And I think Rachel had to get off. So Wayne, do you want to take this?
I was hoping Rachel would be here because she has really all the details. I'm going to ask if Jerry Herbage, because he actually reviewed the agreement, possibly he could weigh in on this. This is a continuation of all of our really the recovery activities we're engaged in now. We're really trying to get together a number of programs to help our business community. This is one of that extensive number of programs we're trying to do. So Jerry, do you have any specific information on this one? I did not prepare for that, thinking Rachel would be on the call.
Jerry, we can't hear you if you're trying to talk.
Well, this is the program. I can tell you this. This is the program we're standing up with Community Lending Works and some partners, including several cities in the county, to get some matching funds to put together this program. And at this point, I think what I would do is defer. I'll get you a broader and better update at the next meeting. And hopefully we'll get Rachel back on this, but I apologize. I thought we had somebody who had all the details here.
I think she was on and then had to jump off and
Okay.
go through another meeting. Let's just plan.
Well, we do need to adopt this today. We need to move forward with it. So if we can please get a motion to approve it. And it has been reviewed.
Okay, by Jerry, who's not
Yes.
able to talk.
Yes.
Okay, with the request that we get a report on this activity, if possible, at our next meeting, I move that we approve this contract as requested by staff.
I'll second it.
I would just agree that we make sure we have someone to report on this. I have been kind of talking to Rachel, so I sort of understand, but I think it's good for everyone to understand. So all in favor say aye. Aye.
Aye.
All right, motion carries. All right, with that, we will go ahead and adjourn. Our next meeting is, well, on here it says Monday, June 22nd, 2020 at 3 p.m. But we will likely have a meeting on Friday, joint with our cities to discuss face coverings, group size gatherings, and possibly a 24-hour hotel room holds for those cities that still have that. So information will come out and be posted about that potential meeting as well when we have a date and time set.
It's
Sure,
tentatively
Oh.
1:30 on Friday.
Oh, you already have that. Wow. Okay.
Oh, we've been looking at a time, so 1:30 on Friday, tentatively.
Tentatively 1:30 on Friday, though that will be posted when we're completely sure. So, all right. Thank you, everybody. We are adjourned.
I've got a couple of questions. Point of order.
Sorry, go ahead.
I thought we were going to have a discussion on extending the loan authority. Council Belmont?
That was actually in your consent calendar.
Oh, okay.
That was already taken care of.
All right, thank you. Then I don't know because we're having audio problems or not, but I did, for the record, I did vote in support of the consent calendar.
We heard you and then you cut off. So you did get your vote.
All right, thank you.
All right, sorry, I kind of cut us up short. Commissioner Hall, anything from you before we end?
Nope. Great job, team. From the depths of my heart, I cannot express my gratitude for all of you and all the energy that is going into doing everything we can to help our community through this.
Yeah, agreed. All right, thank you. Meeting is adjourned.